So let's talk about diabetes. If you're dealing with it or know someone who is, it can feel, well, like you're trying to read a map in a foreign language. But what if there was an official, expert-backed roadmap? Well, there is. And today we are going to walk through it, turning that confusion into real confidence.
It really can feel overwhelming. There's just so much information out there. But the good news is there's a clear, evidence-based path to follow. In this explainer, we're going to walk you through that exact roadmap, step by step, using the official guidelines that doctors use.
All right, so where do we start? We start at the very beginning, with prevention. For anyone who's at high risk of developing type 2 diabetes, the standards lay out a really powerful proactive strategy. This is all about getting ahead of the game before a diagnosis even happens. So what's the play?
The magic word here is intensive. Seriously, this is not about some vague advice like, hey, you should eat better or try to move more. Nope. The official recommendation is for a structured, goal-oriented program. So what do those goals actually look like?
Here's the first big number to remember, 7%. That's the target for weight reduction. Now, why that specific number? Well, because huge clinical trials have shown that losing even a modest 7% of your body weight can slash the risk of developing type 2 diabetes. It's a real, measurable goal that truly works.
And here's the other side of that coin. The second part of that lifestyle prescription is getting at least 150 minutes of moderate intensity physical activity every single week. We're talking about things like a brisk walk, a bike ride, maybe some swimming. You're working, but you can still hold a conversation. This might be one of the most important takeaways. There is no single one-size-fits-all diabetes diet. The guidelines recognize that lots of different eating patterns work. Whether it's Mediterranean style, intermittent fasting, or a low-carb approach, the plan should be and needs to be tailored to you and your preferences. Okay, so lifestyle is king. We've established that. But what about medication? Sometimes it does have a role to play in prevention. The big question is, when does a drug like metformin come into the picture for someone who doesn't even have diabetes yet?
Now, this is super important. Metformin isn't for everyone who's at risk. Not at all. It's specifically considered for adults, usually between 25 and 59, who tick a few specific boxes. Things like a high body mass index, elevated blood sugar, and a high A1C level, which you remember is that test for your average blood sugar over a few months. It's a very targeted tool.
Oh, and just a quick but really important heads up here. For anyone on metformin for the long haul, the guidelines recommend periodically checking vitamin B12 levels. This is especially true if you're seeing signs of anemia or something called peripheral neuropathy. That's nerve damage that can cause pain or weakness, usually in your hands and feet.
All right, so that's the whole prevention playbook. But what happens if a diagnosis is actually made? Well, that's when the journey really begins, with a comprehensive medical evaluation. And this is all about building a game plan that is 100% personalized to you. And this process breaks down into 4 really clear steps. First, you confirm the diagnosis and get a baseline reading of your glycemic status. That's just a fancy way of saying, what are your blood sugar levels doing? Second, you check for any complications or other health issues. Third, and this is so crucial, you look at a person's support system and any barriers they might face. And finally, you put it all together.
So, you've got the diagnosis, you've got the initial game plan. What's next? Now we get into the long game. The daily habits that really, truly make all the difference. So what does that look like?
The core components are pretty straightforward. Notice that word again, individualized nutrition therapy, working with a registered dietitian. If you're overweight, that target is a modest 3 to 7% weight loss. For kids and teens, the activity goal is a bit higher, at least 60 minutes a day. And a big one, absolutely no smoking or e-cigarettes. All right, let's talk numbers, because in diabetes management, the numbers are a pretty big deal. We're talking about hitting specific blood sugar targets. So what are these goals and how do we keep track of them? For most people, that key A1C test we talked about gets checked about every 6 months. But that's not set in stone. That schedule can get shorter if the goals aren't being met, if the treatment plan changes, or if someone is dealing with frequent hypoglycemia, which is just a term for episodes of low blood sugar. And this is where it gets really interesting, because it's all about finding the right balance. Yeah, the standard A1C target for most adults who aren't pregnant is less than 7%. But, and this is a huge but, it's not a rigid rule. That goal can be and should be adjusted for people who are at a higher risk of having those dangerous low blood sugar episodes. It's all about personalization.
And for those folks who are at a higher risk, we've got some amazing tools in the toolbox these days. The guidelines recommend things like continuous glucose monitors, or CGMs, which give you real-time data on your blood sugar. They also recommend that anyone at high risk should have a prescription for glucagon, which can be a lifesaver in an emergency.
Okay, this brings us to what might be the single most important idea in all of this. Effective diabetes management, well, it's not a solo sport. It's a team effort, a collaboration between you and your healthcare team.
I mean, this quote, pulled right from the official standards, just says it all, doesn't it? Shared decision-making. That is the entire philosophy right there. It means that you, as the person living with diabetes, are an active partner in setting your own goals and creating a plan that actually works for your life. So if you're going to walk away from this with just a few things in your head, let it be these three. First, prevention is powerful. A structured lifestyle plan can make a world of difference. Second, your care plan has to be personalized to you, from your diet to your A1C goals. And third, you are not a passenger on this journey. You are a key partner in your own healthcare. And that leaves us with one final, big question for you to think about. When you reflect on your own healthcare experience, is your health plan a real conversation built on shared decisions? Or does it sometimes feel more like a prescription that's just being handed to you? Understanding that difference, that's the first step to becoming a true partner in your own health.